So from a midwife's point of view, Marie Louise, would you say is the emotional and cultural impact if a never event like a retained swab happens on a mother, of course?
Yeah, well, on a mum, I mean, they're particularly vulnerable in the first instance anyway, especially when you've just had a baby and your body's been through pregnancy, it's been through birth. Sometimes that birth in itself can be traumatic. But I think when it comes to never events, there's an added layer of feeling like you've been let down, like you've been failed, perhaps like you've put your trust in people that actually weren't deserving of that trust. And I think that it can therefore lead to long-term problems in distrust for clinicians, for organizations such as the NHS, because well, that's what happened to me before when I trusted them. And it can be really difficult for mothers to overcome that psychologically.
Okay, and from a clinician's point of view, because obviously you've got clinical teams, etc., maternity team, surgical team. How important is that psychological safety in surgical and maternity teams, especially when you're counting and then there's a miscount? You know, how important is that? How much do you think something like an iCount, whereby you've got security in that you've counted it correctly, could help that?
Yeah, so when it comes to psychological safety specifically, that is just as important as physical safety. We know that from all the statistics surrounding birth trauma and how when women do not feel heard, that significantly contributes to birth trauma. So we know that the psychological safety is extremely important. And when it comes to devices to support clinicians to maintain gold standard practice, best practice, and avoid never events, then if there's a simple solution to reduce or even stop that altogether, then for me it's a no-brainer. Like why wouldn't you want to do that?
Exactly. And if you were speaking directly to a hospital leader, for example, or let's even say a procurement department, we all love the procurement department, what would you say to somebody who is saying, well, yeah, we could take that on board, but actually it's going to cost us X amount? What would your conversation be with that sort of person?
We have to look at the costs. Well, a couple of things. First of all, you have to look at, if we're just talking about numbers, the cost of claims and the impact that that has on the unit and also on the staff, and the cost that that has on maternal mental health, as we said, and psychological safety, and also the cost that that has on the clinician. Because when clinicians are tired, when it is 3 o'clock in the morning, of course, it's easier to make mistakes. And we have at the moment a global and national shortage of midwives. You know, our clinicians are already under extreme pressure. So if there's a solution to reduce that pressure and enhance their ability to practice to the best of their standard, then again, you know, it's a no-brainer. So I think there are cost implications financially, but there are also cost implications both for patients directly and also for clinicians.